Hi, this is Dr. David Tenner. We're here at the Goldberg Clinic where we specialize in the reversal of chronic disease. And I'm absolutely thrilled to be joined today by Ms. Barreto and her daughter Isabella. Isabella originally came to see us back in August of 2017, and I'm just kind of going to give the results up front, and then I want to have you tell your story and the details. But Isabella came in after having been diagnosed with Graves' disease. She had very high levels of thyroid hormone. She also had a very low level of TSH, and her problem was quite significant. And today, well, this was about 2 months ago, but this is her first follow-up visit since that time. She had new blood work done, labs absolutely normal, feeling good, off all drugs. So it's been quite a journey, and so we're thrilled with the changes. But Isabella's story is quite important to tell. We work with many people with thyroid issues. People develop these problems for different reasons, and so we really had to sort out the reasons that this was going on with her and address them directly, and then take steps to build health. So, Isabella, tell us a little bit about what brought you in originally, the problem you were having, the symptoms you were experiencing, and what they were doing with you medically at the time.
So it was August of 2015 that my pediatrician first had me go visit an endocrinologist because they noticed I had a goiter and vitiligo on my hands. That was all a manifestation of what we found out was Graves' disease or hyperthyroidism. So in 2017, we'd basically been trying medication, and that wasn't a good long-term solution. So my endocrinologist had said we should do something more definitive, which meant obliterating my thyroid with radioactive iodine or surgically removing it. So
What drugs did they give you originally?
it was methimazole and then metoprolol to lower my heart rate because my resting heart rate was more
130.
Yeah, it was 130 beats per minute.
Which is quite high. Of course, normal is somewhere between about 60 and 90. So yeah, 130 is a significant concern. So they were giving you drugs, and when the drugs weren't controlling your symptoms enough, the medical answer to that was to remove your thyroid and or burn it out with radioactive iodine, which would have been tragic for a young girl at the time. You were 14 or 15, I believe, to have lost her thyroid gland, which is a very important gland in the body. It controls vasometabolism and other functions as well. And you would have been relegated to taking thyroid hormone replacement as a result for the rest of your life, which and you can still be relatively healthy doing that, but it's not the same as having your own gland. And you want to have your own thyroid secreting its own hormone in the right amounts and monitoring those levels on a regular basis.
And it would have definitely affected me as I was moving through teenagehood as well.
Yes, it would have affected your development as well. So Isabella came here at the referral of your chiropractor, right, Dr. Cameron Guida, who's an excellent chiropractor, and his wife as well. And we did an evaluation on you, we did an exam, we took a history, and we didn't treat your symptoms, we didn't treat your disease. What we looked for were factors that were contributing to the problem, and we did find something significant, didn't we?
Yes.
I'll let you tell that part of the story. Go ahead.
So I remember when we first came here, you ran all of these different comprehensive tests, and one of them was on, so it was a toxicology test. And what we found was I had very elevated levels of arsenic and volatile organic compounds and organophosphates. We had to test all of those things to see what was in my system, and turns out there was a lot of arsenic in my body.
Yeah, so we found some things that she was being exposed to that are known to disrupt endocrine function, particularly the thyroid gland. And of all the tests we did, those really were the major factors. We did find some digestive issues that we needed to address and some other nutritional issues and biochemical problems that we need to clear up too. But the major problems was a toxicological issue. So we were able to identify some of the sources of those things and address them, and we repeated some of those tests later on. They were looking a lot better. Those levels had dropped off quite a bit. And then we gave it some time, right? And your medical physician, the endocrinologist was monitoring your levels, and we were watching what was happening. And it's been a big change.
It has.
Yeah.
Yeah, it's really been amazing, I think, for me, because when I was diagnosed with Graves' disease, I was told it was basically incurable without killing or removing the thyroid. And then to be living now with my thyroid functioning normally, at normal levels, not experiencing any of the symptoms that I was before, it's been truly amazing. And of course, having my arsenic levels go down and getting all of that out of my system contributed heavily to that.
Yes, I believe it did. And if I had a nickel for every time somebody told me, they told me my disease was, irreversible, I'd have to live with it for life, I could probably retired already. The fact is that these types of problems, including Graves' disease, are considered chronic health issues because it's assumed that people are not going to get well from them. The word chronic just means they're just going to be ongoing. And medically, the best they generally have to offer is symptom management with drugs, or in your case, burning out your thyroid or removing your gland. And it is true, if you take drugs, then of course the problem is not going to be solved because it's not addressing the real issue. So the question that we ask when people come in is, what's causing your problem? What factors have led to its development? We can identify that and address those factors directly and then take steps to build health, and we watch people flourish and their problems start to resolve. And there's of course many examples of that on our website, and Isabella is just the latest example of that, which we're thrilled about. Ms. Bray, I want to bring your mom in. Anything you'd like to add about the story and about Isabella's progress?
I guess I just appreciated the way that you did a comprehensive test. You probably must have run 20 different tests when we first came in.
It was anything and everything that could come out of me.
Well, yeah, the situation was urgent, and we
Yeah,
didn't want to leave any
right.
stone unturned. So we don't
Right.
necessarily run all those tests on everybody,
Yeah.
but we didn't want to miss anything in your case, and I'm glad we did do all those tests on you.
Yeah, and even after we ran that initial battery of tests and we still didn't see her levels improving, then that's when you said, okay, let's run this extra battery of toxicology tests. And we were reluctant at first, but after some pressing and encouragement from you and Dr. Goldberg, we finally agreed, and that's where really the
Yeah.
answers came out.
And I'm glad we did. Sometimes we have to go back to the drawing board. So these are complex issues, and there are sometimes things that aren't obvious that show up just from the history and from the exam and some basic blood work. So Dr. Goldberg and I kind of consider ourselves detectives. We try to really sort out where the problems are coming from and figure that out in detail and then work with the patient to address it. And we got to give Isabella a lot of credit because when we work with people, we're not just sending them home with pills to take. It required effort on her part. We gave her a full program that she had to go home and implement. That maybe at times wasn't convenient to incorporate some of the changes we had her make. And she really stuck it out. It's been about almost 2 years since we first saw you. And Isabella showed a tremendous amount of patience and perseverance. Anytime we work to resolve a chronic health issue, they're not generally things that are going to resolve in a few days or a few weeks. People evolve into these, sometimes over years. And so it takes time and patience and perseverance and hard work, which you were very willing to do, and you've reaped the rewards of all that effort now. So now we're going to monitor Isabella periodically and work to maintain these improvements and hopefully continue to watch her grow into an adult and go off to college and do all the things that you want to do. You were just telling me that you want to go into what field? What kind of things do you want to do?
So I really am hoping to pursue a college degree in vocal performance or musical theater, and that's really where we're headed right now. Yeah.
Very cool. So when Isabella's famous, you've seen her here first at the Goldberg Clinic. All right. Anything else you'd like to add, ladies?
I think what I personally appreciated the most about you and Dr. Goldberg's approach to my condition was how you approached it recognizing that everything in the body is connected. It wasn't just something where you could cut off the top of the weed because it's still there, the underlying cause, the root cause is still there. And I think that mindset is what led to really discovering the root issue, because if I had gotten my thyroid out, not only would I have been on Synthroid for the rest of my life, the underlying cause wouldn't have been resolved, and that could have popped up in any shape or form later on in life.
You make a great point there, and I couldn't have said that better myself. Because yeah, you're right. You can surgically remove, say, the effect, but you can't cut out the cause of the problem. And what likely would have happened, of course not a guarantee, but what likely would have happened is that you would have developed issues somewhere else in the body. as a result of the underlying problems never being addressed. So you could be a doctor. She does, it's a very good point. All right, so Isabella, Ms. Barreto, we are thrilled with the changes. We're going to continue to work hard with you to maintain these good results, and we very much appreciate you sharing your story.
Yes, and thank you.